let's begin. So, our topic is how to think structurally. So, as we all know, I will be dealing with some headings so that you can go to that headings while you are beginning to write a essay question or a 5 marker question, whatever mark you have given. So, sometimes you will be blank about some questions. You are not able to write anything about that question. So, if you think in the following structure, something you will be getting to put on each headings. Okay. So the weightage of each headings will be varying according to which year you are studying. Suppose you are studying in second year, you will be getting more weightage for etiology and pathogenesis headings for pathology paper. As far as pharmacology is considered, you will be getting treatment part for more weightage. So as far as community medicine is concerned, if you are studying in third year, then you will be getting more weightage for the prevention component. Okay. So I will be dealing with each headings and how to think about each headings. Okay. So firstly, whatever topic you are getting, you have to think about an introduction component, 1 or 2 lines about that topic, or sometimes it may be a definition of that topic. Okay, suppose you are getting a essay like chronic liver disease. So what should we be thinking of? This chronic stands for any liver pathologies which are standing for more than 6 months. So that could be our introduction. Like that, there is an example I told for simply. Then the second component you have to think while presenting a topic in paper is etiology. Okay, etiology in simple terms, it means cause. Suppose it's an infectious disease, there will be a specific organism which causing it. Okay, so similarly, the non-communicable diseases are usually not associated with an organism at all. There are some risk factors for non-communicable diseases, right? For example, hypertension, diabetes, this and all are having not an organism, just having obesity as risk factor, then dyslipidemia, like that only. And sometimes there could be associations. Okay, suppose the tracheoesophageal fistula, it's usually associated with the vertebral anomalies, then cardiac anomalies, renal anomalies. So these are some associations. Sometimes there will not be any risk factor also. Okay, that's regarding the etiology. Then the third component you have to think about and topic is the simple term for etiology is cause, right? Okay, then the heading is pathogenesis, right? So 1 or 2 sentences, better preferably this is given more weightage for the second year students, right? You have to represent by the flow charts. Okay, so that is the scheme of writing. Then beginning with the final year part, that means the medicine or surgery or ops or gynae or pediatrics. We are more bothered about the clinical features, investigation, treatment, that part only. So you have writing the clinical features, you have to split into following headings, right? Firstly, the symptoms. Okay, the next one is signs. So what mean the symptoms? What the patient says, signs what the doctor sees, right? Then you have to write the closed differential diagnosis, how to rule out them. That's also important component. For example, you are writing about an hydrocele, which is a 5 mark topic. So in hydrocele, it is that swelling is usually transluminant swelling. So there are other transluminant swelling also. So we have to rule out that component also. So in clinical features, you will be dealing with symptoms. On examination, what you see, that is mean by signs. On examination, what you see, right? So then the DDs, how to rule out each differential diagnosis, which is close to that. Okay, so that's regarding the clinical feature. Then the heading is management. Okay, in management there is 2 components. Suppose a question is asked to manage a condition, you have to write both investigation and treatment. Okay, suppose it's a 2 mark question, the management is given for 3 marks, then each will be giving 1.5 marks each. Okay, so both components you have to write in in management part. Okay, this is the basic thing you have to remember while answering the management. If the word is management, you have to write both investigation and treatment, right? So don't forget regarding that. Okay, as far as investigation is considered, what are the components you have to think while you writing about investigation of a condition? Okay, so while writing about investigation, you have to think about four things. Okay, and another thing you have to mention is, while writing an investigation, you should be dividing the investigation into two components. One is what is the investigation and what is the findings in your case. Okay, suppose you are getting the alcoholic liver disease patient. So what will be the investigation? The investigation of choice is LFT, in which the finding is AST is to ALT ratio is more than 2:1. Okay, so this is the part of investigation. So just writing the LFT, RFT or CT or MRI or ultrasound will not fetch you marks. The thing we have to write is the what are the findings in your case. Okay, then how to rule out other DDs using this investigation. Okay, suppose the other DDs for this one is viral hepatitis. Okay, so suppose the chronic liver disease was the SA. Okay, the other DDs, other differentials. Okay, for this condition could be such as viral hepatitis. So what could be the investigation to rule out that differential? Suppose HBsAg, right? That is the way you have to think regarding the investigation. The second component is rule out the differentials. Okay, then the third component is identify the cause of that disease. Okay, suppose the CLD is asked, the investigation you have to think in the ways the causes for chronic liver disease include alcohol, then non-alcoholic steatohepatitis. So then similarly, the etiology what you have written, you have to think how to rule out that cause for this disease. How to rule out that cause for this disease. Suppose hemochromatosis is a part of chronic liver disease, right? Then Wilson's disease. So serum ceruloplasmin levels. Okay, this is an example, right? Okay, so this is important to rule out the cause of iron related or copper related metabolisms. Okay, as a cause of chronic liver disease. So the third component while writing investigation is cause. Okay, to rule out what cause. Suppose you are writing about iron deficiency anemia. Okay, in iron deficiency anemia, there are many causes. First thing is the hemorrhage, the chronic hemorrhage due to menstrual loss or any then for example you are dealing with iron deficiency anemia. The causes could be sometimes for example the worm infestation, right? So what could be the investigation? Then stool for the cyst or the organism, right? Stool microscopy, like that. So then sometimes it could be cancer colon. Okay, so esophageal duodenoscopy you have to rule out to identify the cause, right? So that's regarding the investigation, third component. Then the fourth component is to rule out complication of that condition. Okay, complication. Okay, suppose you are dealing with a chronic liver disease. The complication associated with that one is portal hypertension, right? Then the hepatic encephalopathy. These are the complications which can form from a chronic liver disease patient. So how will you rule out the hepatic encephalopathy? The bleeding time, clotting time. These components are not usually told while you thinking in this manner. So to include that in also in your mind, the BT, CT, so bleeding time, clotting time, then serum ammonia levels, the investigation and what will be the findings if that one is present. That means the serum ammonia levels will be elevated. You think in that way while writing the investigation. These four headings never forget. Okay, so DDs rule out, then complication, causes. So this could be the 4 points you remember. Okay, CD twice, you can remember like this. diagnostic investigation, DDs rule out, then cause complication, DD twice. Okay, so that is the another component. Then the fourth part of the the management second component is treatment, right? Suppose you are blank about that treatment of that condition. So the treatment they have asked could be the specific treatment of that condition, right? Suppose you are dealing with cholera. The question was asked regarding the cholera. You does not know the specific treatment for the cholera is what antibiotic we are going to use, right? Suppose the doxycycline, okay, or whichever be the antibiotic. So this could be the specific treatment of that condition, but you don't know regarding the antibiotic component, okay, but you know the symptoms of that disease, okay. Then the second component of treatment part is firstly the specific treatment of that condition, then the symptomatic treatment, right? Symptomatic treatment, okay. Then the third component is treatment for the complication, okay. So if you does not know regarding the antibiotic for cholera, then what should you write if the 2-mark question is asked regarding the treatment of the cholera? Then symptomatic treatment, you know it's a condition which the patient is having rice water like stool, so there could be dehydration, right? So the symptomatic therapy will be ORS. Sometimes the patient is having infection, so we can give paracetamol, hydration, rest. This writing in structurally we can fetch more marks rather than writing simply doxycycline and lefting that place, okay. Just simply splitting into more headings. Then it can cause severe dehydration, can cause shock, right? So to treat the shock, how will you going to proceed? You will proceed by ringer lactate or normal saline, IV fluid resuscitation. You are going to proceed, right? So in this way you have to think while writing about the treatment of a clinical condition. The treatment algorithm is usually the pattern of thinking usually same for the every subject in final year, third year and all, but the obstetrics, the gynec part is also same, but the obstetrics component is having a different steps. It's usually divided into antepartum management, intrapartum management, postpartum management. There's a subdivision, right? Okay, so that part we will discuss in another component, okay. So at this point you have to remember is this is the usually you are blank about something treatment of a specific condition, and you can think in this way, okay. So the complication treatment and the symptomatic treatment of that condition, then the specific treatment. Usually if a one word is asked, you have to write regarding the specific treatment, right? In that way you have to think, okay. Then the next component you have to think is the complication, okay. Next heading while writing a topic is the complication, okay. There's not much regarding to tell in complication, okay. Then so the next heading you have to think is prevention, okay. Suppose there is an infectious disease in which the vaccine is there, so you should mention regarding if the question is asked for 5 mark and all, the prevention component you have to concentrate. Suppose you are learning the community medicine part, then you have to think more regarding the components, the primordial prevention, primary prevention, secondary prevention. That way you have to write. So the basic headings will remain the same throughout the all MBBS, and it's not regarding the first year. First year these things are entirely different scenario. So in first year setup, the another headings we have to deal with. So in other years you have to go through this part, okay. Then the complication prevention, okay. Then if at all any vaccine is there, you should mention regarding that. So that is regarding the how to write a topic while you are suppose you are learning an essay question. So how will you remember the components, okay. So you just think regarding the definition of that condition, then you think regarding the etiology or risk factors, then pathogenesis, then clinical features in which symptoms, signs, DDs rule out. So in this way you have to think, right? So this is the how I elaborate on think structurally. So in this way, if you are blank about any question in your paper, you never have to tense. You think in each headings in systematically, then you will be getting some points in each heading. Then you scribble whatever you got while thinking in this way. So sometimes you may get in hurry these headings are and all complex and all. If you apply these steps in 3 or 4 questions you are seeing in your question paper, then your part will be much more safe. Okay, so the any headings you cannot miss. If at all you apply this for 3 to 4 times in your paper, or 3 to 4 times before going to exam hall, you just think in this way regarding any topic, these headings will stick on to your mind, then you can reproduce easily whatever you learned. So this is the one tip, and let's hope you enjoyed this session, and that's the end of this discussion. Thank you and have a nice day. So keep supporting. Thanks for watching and keep sharing.